Dr. Svensson may be able to answer that a little better for you, but anyway, it's how does oral health affect overall health? And this is kind of a pendulum that swung for years and years. 100 years ago or whatever, folks felt that anytime you had an infected tooth, you better take it out or you're going to have sepsis or whatever, and you're going to have abscesses here and there. And that was something that then over time they pretty much disproved, an occasional case of an issue. But now it's gotten back to where there are concerns with inflammation of the gingival gums and predisposition towards diabetes, or making, if you already have diabetes, making it worse. Pro-inflammatory factors with cardiovascular disease, and all sorts of things. Of course, if you're having trouble with your teeth, your nutrition's not going to be very good either, and so there's that component as well. Something that I think we haven't really talked about is, and I'm sitting here myself having trouble, but is dry mouth. And dry mouth is really a significant issue in a lot of people, and when your mouth is really dry, it leads to increased risk of yeast infections in the mouth, cavities, all sorts of things, and burning mouth symptoms and stuff like that. So that's a real problem with our senior citizens. And you can have diseases that cause your salivary glands not to work quite as well as they should. But in addition to that, a lot of us are on medications that also decrease salivary flow. And that's something that can be, there are some treatments that can help with that. But good oral hygiene is probably the key. But anyway, you may want to talk to some of the periodontal.
Well, I got kind of just to expand upon that, and actually going back to the University of Emory, Steve Offenbacher, back in the 1990s, published one of the first papers that showed this relationship between the mouth and the body. And what he found, to the surprise of everyone in a study of pregnant women, was periodontal disease seemed to be a risk factor for low birth weight preterm babies. And everyone goes, low birth weight preterm babies, gum disease, no way, Jose. So that's what the medical community said. They repeated the study at Johns Hopkins University, and guess what? A relationship between low birth weight preterm babies, because some of the inflammatory mediators that were being, as an aspect of the disease, do impact the placenta, can cause uterine contractions, and in fact they could find a very nice relationship between the chemical mediators that were produced by the bacteria, or in response to the bacteria in our mouth, and in fact low birth weight preterm babies. Well, this kind of opened up a door for investigation. So pretty soon we find out, gosh, there seems to be an association between periodontal disease and cardiovascular disease, the incidence of ischemic stroke, pneumonia, brain abscesses, which we already realized that there was a relationship, but the more we seem to look, the more we seem to find these causal associations. Now, there's not quite to the point where we can say, true cause and effect, but we see it again and again and again, and we've found we can trace the chemical mediators that can explain these types of interactions. So certainly a major impact of and I think it was medical Coop that had said, that the mouth, you look in your mouth and you can pretty well, like a horse, know how healthy someone is.
Any other questions?